Uh, Today's topic at the CME program is care of elderly in the general practice with a particular reference to dementia. So I have my good colleague, Prof. Asitha, and myself, and let me tell you in advance that this Asitha and I have done this before to a different audience of all females at Ladies College some time ago. And it was for the old girls of Ladies College, so it was an appropriate audience to do it too. And I think they appreciate it a lot, and I hope they are practicing some of what we told them. Okay, so without further ado, and we have been given 90 minutes between Asitha and myself, and we have been warned to stick to that, and both of us being lecturers, I'm sure they are scared that we might go over our time, so I'll assure you that we will stick to time. This is the overview of what Asitha and myself will be doing today, with a particular reference to dementia, of course, about the diagnosis, that's the risk factors and how the patient presented, then what screening procedures are available, and you'll be given a handout also about the screening and detection. Then diagnosis and assessment, Asitha will talk about. Then promoting of independence of patients, the shared care when they come back to the primary care level, what we do. Then what are the current interventions available for dementia, pharmacologically, non-pharmacologically, screening, what's the latest data, Asitha will tell you. And of course, palliative care. With regard to palliative care, let me just diverge for a second and tell you that this is a total coincidence. We have just concluded a 2-day certificate workshop with the Palliative Care Institute in Cochin, India. 2 of the resource persons who are here, so it is certainly not planned. And we had a huge audience at that palliative care program. And it was a certificate being awarded, and unfortunately it was not just given, you had to earn it. So we are waiting to see whether he has corrected the papers and whether some of us have indeed got through in the palliative care area. Right. So who are the elderly? Certainly I am also now elderly now compared to another section of the population, the kids and so on. So it's a relative thing. But in a scientific field, you can't be subjective. You've got to be objective. You have to have criteria to define an elderly and so on. So if you say retirement, ages of retirement even in Sri Lanka differ from place to place. And if you take the region and the world itself, it differs. So we have, there is a accepted definition for the old, that's the elderly, the young old, the old, and the extremely old. So those are the parameters which we use, and you will see its relevance in a few moments. And of course, the speciality of dealing with the elderly is geriatrics. And let me draw your attention to the